Assalamu alaikum wa rahmatullahi wa barakatuh. For this session, it is community health session. It is about the disaster in the community. So the definition of disaster. Disaster, it is any occurrence that cause damage, ecological disruption, loss of human life, deterioration of health and health services on a scale sufficient to warrant and extraordinary and extraordinary responses from outside the affected community area. So any disaster or anything, any damage that the community or that site or that region they cannot cope with, and they need the help from outside the region or the town or the city or the country. This is the definition of WHO, the World Health Organization. Disaster can be defined as an occurrence, either a nature or man-made. So it might be natural or it can be man-made that cause human suffering and create human need that victim cannot alleviate without assistance. So it will create a human need that need assistance and help from other. This is the American Red Cross definition. The hazard, it is any phenomena that has, so there is a difference between hazard and disaster. The hazard, it is any phenomena that has the potential to cause disruption or damage to people and their environment. So the hazard, it is the it is the cause of the disaster. So the hazard, it is the natural event, while the disaster is the consequence of the hazard. So a hazard is perceived a natural event which it threatens both life and property, and the disaster, it is the realization of this hazard. This is by John Wittons. When hazard involve element of risk, vulnerabilities and capabilities, they can turn into disaster. So hazard may be inevitable, but disaster can be prevented. So hazard, it is an inevitable thing, we cannot prevent it, but the disaster, it can be prevented if we are taking a precaution and if we are identifying the hazard early before it is coming. The type of disaster, we have two main types of disaster. We have the natural disaster and the man-made disaster. The natural disaster, it is from nature, like earthquake. So the earthquake, it is by the nature. You know that there are some area which are more prone to the earthquake, and floods also, it is from the environment and from the nature. Droughts and cyclone, tsunami, all are from the nature and changes in the environment. The man-made disaster, it is the nuclear radiation and nuclear weapons. It is a disaster which is made by man, by the human being, accident, aircraft crashes, wars, chemical disaster, chemicals explosion, and it is made by a human being. Also biological weapons and biological wars and viral bacterial war, all are made, might be made by the human being. The man-made disaster, we have technological, which is the transport system failure, and also public place failure or fire, or from the technology, from the technological chain. Industrial, like in chemical factories, if there is chemical split, it will lead also to disaster. Radioactive split also. Radioactive spread from any institution that deal with radioactive material. Warfare, war, terrorism, internal conflict, civil unrest. So all are causes of disaster which is made by man, by human. So activity that reduce the effect of the disaster. In order to reduce the effect of disaster, so we said that from the disaster we have earthquake, we have also cyclones. So the code of building, it can be managed, and the zoning of the cities, it can be managed and prepared in order to protect from the earthquake, from floods. So the construction of that building which prevent shaking or prevent destruction during shaking, prevent flooding if we are building it high and not under the ground, with the protection, vulnerability analysis before doing and analyze all the variables that might lead to the hazard in order to prevent them. The education of the people, and which also help in the prevention of the disaster. So if the people are educated, they can manage and deal with the disaster in a proper way, and by that we will prevent the consequence or most of the consequence of the hazard or the disaster. Mitigation also, and activities following the disaster. There are temporary shelter and evacuation of people and giving them suitable shelter to protect them, and giving them food, and cleaning, processing also for losses, grants and medical care of people who are in need for medical care. Activities prior to the disaster. Preparedness plan, to have a pre-ready plans for the assisted or the expected hazard and the expected problems that might happen. Doing emergency exercise. If that floods happened, if earthquake happened, what to do? Training of people in dealing with cases and also in dealing with the hazard itself and protecting themselves. Warning system. So we have to have also a warning system. You remember before the cyclone Shaheen is coming, there were several warnings that cyclone is coming to the country. So those who are toward the coastal area, they have to be cautious, they have to move and not to go with any activities that might lead to loss. So to be prepared and preparedness for the case. Integrated disaster management when the disaster happened, and the responses that it has to be planned, and there should be committees, and everyone should know what to do in case of the disaster. Also, the recovery and activities during a disaster, public warning system, the emergency operation, the search and rescuing of people, providing shelter, and then preparing for ready for the recovery after the disaster. Phases of disaster management: disaster preparedness, to be ready for with your plan of action before the disaster is coming. Disaster impact, and to assess what the disaster impact is there, and disaster responses, and disaster recovery, disaster mitigation. We will see each of them. So disaster pre-readiness. The disaster pre-readiness, it is ongoing multi-sectorial activity. So it is not from one sector. It is a multi-sectorial activities from all ministry, from all institution, every institution. It has to have its own plan in case of disaster. Integral part of national system responsible for developing a plan and the programs for disaster management, which is the higher committee for management of disaster and dealing with those issues. The prevention and preventive measure, mitigations and responses also, how to respond, rehabilitation plan, reconstruction. So they have to be ready for the expected hazard and the expected disaster that might come, and prepare their plan for prevention, for mitigation, for the response if it is happened, for the rehabilitation of the cases and the rehabilitation of the community after the disaster gone, and reconstruction and rebuilding what's destruction happened after the disaster. Disaster preparedness, which is coordination of variety of sectors to carry out evaluation of the risk. So they have to evaluate what kind of risk which the country is prone to, adopt standard and regulation, organization, communication and response mechanism, ensure all resources are ready and easily mobilized from area to area according to the need of those resources, because we might have the resources, more resources in certain area which doesn't need that resources. So we have to easily access them and easily mobilize them to other area. Develop public education program and coordinate information with news media. So there should be a responsible committee for the coordination between the committee and the media in order to avoid rumors. Disaster simulation exercise has to be done every now and then to prepare the people for the occurrence of that disaster if it is expected. Medical preparedness and mass causality management. So in case of disaster, there might be multi-injury, and there will be a need for rescuing those people and treatment of those people. So we have to developing and capability building of medical team for trauma and psychosocial care, because it is not only the physical care, it is the physical care and psychological care for the people who are injured, and also for those who saw what's happened during that period. Mass causality management and the triaging, and the ability to do triaging for those cases and to shift them to the best area for care. Determine causality handling capacity for all hospitals. So they have to be able to know the capacity of each hospital and how they can manage with it. Formulate also appropriate treatment procedure. Involvement of private hospital in this case. In case of disaster, all the hospital, it will be under the committee, and they can transfer a client not only to governmental hospital, they can transfer them to private hospital, and they will work hand to hand with the governmental hospital in the same way that the governmental hospital are providing the care, according to the same system as an emergency case. Identify healthcare centers that can function as medical units. And also identify structural integrity and approaches route. They might build also inside temporary hospitals for taking care and for triaging of those cases. Disaster responses, it is the immediate reaction to a disaster as the disaster is anticipated or soon after it is begin in order to assess the need and reduce also the suffering and limit the spread and the consequence of the disaster, open up the way for rehabilitation by mass evacuation of the people. Evacuation, if it is expected, it can be evacuation before the disaster coming, or during the disaster, or during the this is from the responses, search and rescuing of people, search for injured people and lost people and rescue them, emergency medical services at the site and also shifting to medical side, securing food and water for the people, because in this case, in many cases of disaster, water pollution might be there, the food it might not be available, so we have to deal with feeding those people, that we save them and outside shelter, and also providing them with clean water in order to avoid diseases which might be due to contamination of water. Maintenance of law and order. It is very important to maintain law and order. The happening of disaster doesn't mean that all corruption will be there and there is no law and no inspection of those who might break the laws during this period, because some people, they might break they may take it as opportunity to break the laws during the disasters. Disaster impact responses. Search and rescuing and doing first aid for the client. Field care, giving the care at the field. Triaging and tagging the people according to their need, and identification of dead people. Triaging them, transferring them to the healthcare institution. Medical and public health responses, food safety and water safety. So there should be a committee for looking after the food and its safety and water safety. Animal control also, dead bodies can also flood on water, zoonotic disease can occur, and in order to avoid transmission of disease. Vector control, mosquito and rodent, it might be increased during after disaster. Communicable disease control also, like eruption of measles, diarrheal disease like cholera, and the malaria breakdown and environmental safeguard. So all of this can happen. Crowdiness, because of the crowdiness of person also in the camp, malnutrition, this decrease the immunity of the people, and contamination will be more due to that, because the effect sometimes it will affect the sewage system, it will affect also the collection of garbage system, the presence of dead body, presence of contaminated water, presence of some lakes, and all of those, it will lead to breeding of insect and flies sometimes. Waste management, temporary litters needed for those people sometimes to use them. Chemical toileting sometimes. sewage disposal and damage, and immunization against some diseases that can be preventable. Medical and public health responses, management of hazardous agent exposure, particular matters, also infectious agent in hospital or scientific laboratories in case of hospital damage or scientific laboratories damage. So those agents, it might lead to spread of infection. Mental health, specialized psychological triage should be there, and treatment significant in case of tourism, and even in case of any environmental hazards. Also, psychological state or mental state, it can be affected due to mass destruction, due to sometimes mass deaths and mass injury. This will affect the people who are still alive and seeing all of those scenes. Information, so behavior contagion handling and risk communication should be there, and avoiding of rumors. Consequence of disaster on the health, it is the entanglement, injury, disability, coma, and death. So all that might happen. The psychologically, cognitive and behavior and social changes can happen due to loss of wife, loss of husband, loss of mother, loss of father. So all will lead to those effects. Structural damage to variable extent, structure of the city structure, in the infrastructures, the structure of building, ecological, the changes in the ecosystem that might happen due to the change, economical and financial losses, losses of their job, losses of their properties, losses of their houses, losses of their company, losses of their goods, all losses of their money. So all can happen. Symptom after the disaster, the symptom after the disaster, we can observe the psychological symptom, cognitive symptom, emotional symptom, and behavioral symptom. Under the psychological symptom, the client will feel fatigue, shock symptom will be there because it is an non-understandable condition that's happened, and he might see many details, profuse sweating is there, fine motor tremors, chills, teeth grinding, muscle ache, dizziness. You might observe all of those physical signs on the affected person. Cognitive symptom, memory loss, either due to the event itself or due to trauma. Distractibility, so the person is distractible and he cannot concentrate. Reduced attention span to others. Decision making also difficulty. He is unable to take the proper decision. Calculation also difficulties, difficult to calculate. Confusing, trouble with a major issue. Emotional symptom, anxiety will be there, feeling overwhelmed, grief, depression, anticipation of harm to self and others sometimes, so he might harm himself or others. Irritability will be there. Behavioral symptom, insomnia, unable to sleep, substance abuse sometimes, or those people, they might shift to substance abuse, alcohol or narcotics. Klaus humor, gait changes, ritualistic behavior, hyper vigilance, unwillingness to leave the scene or to leave the area of the disaster. So he want to stay there. Factor which may affect the reaction: disaster-related factor, lack of warning. So if lack of warning, the extensivity of the disaster, it will be more. Scope of event also, is it fast or it is gradual? Abrupt contrast of the scene also. Personal loss and injury, type of the disaster, traumatic stimuli, nature of the destructive agent that's happened, human error during that time of occurrence of that disaster, because if it is happened while the lack of warning is there, people are sleeping, earthquake is happened. So if destruction, it means that losses will be more. Environmental, temperature and humidity and pollution, which happened during the disaster. Host-related factor, the health of the host, disability, invalid also medication problem and medical problem. So disability, it might be for those who are disabled, they cannot escape, and the disaster itself might lead to disability. Medical problems, also those who are having medical problems, they might not having their drugs, they might not able to get that medication that they are using. So exposure to hazard, it will be more. Social lack of support network like divorce, widowhood, cultural language barriers. If it is happened while you don't understand the language of the country that the disaster is happened in while you are there, so you might prone to more, you will be more exposed to the disaster than others. Demographic, age, younger and older are having more difficulty than the adult and youth. Sex also, more stress in women, but more resistant. They are more resistant and they more tolerable. Past history also, traumatic event which happened before, mental illness or emotional problems if it is. So in Oman, or which is the official e-government portal, you might find the emergency disaster procedure. Child care, business, family, religious welfare, health and support, law and safety. So individual dealing with the disease, unfolding. So at the current of any rain, so it will give you this consequence, what to do if rain is there, if damage is there, if floods are there, what to do, how to evacuate, where to go, which area it would be more safer. So it is there in the site, and it gives the people how to deal in case of floods. The earthquake, in case of earthquake, it has happened. In case of your place is being hit by earthquake, you are supposed to do stay out if you are not inside the building. So you have to stay out. You will be more safe. Stay inside if you are in, and hide under a strong table or a strong corner, which usually the corner it has that good construction and more stronger construction, so it might be helpful. Do not exit the building until being asked to do. Use stair instead of elevator, because electricity or power failure might happen, so don't use the elevator. Don't overuse the cell phone unless you are completed and to be used radio instead of that. Follow the emergency plan set by officials in order to avoid listening to rumors. Stay away from the beach or any water fronts. Also, take into consideration the subsequent shake which cause additional loss. So, because sometimes if earthquake is coming, there are subsequent earthquake that might come after that. Institution dealing with disaster, emergency plan, all the procedure and necessary measures. If any disaster take place beside the evacuation plan for any institution, that is the member should follow to be ready for the emergency situation in a way that it fits the nature of the disaster. So each institution, it has to have its own plan for evacuation and dealing with the hazards in case of hazard. So evacuation in case of fire, in case of floods, in case, so evacuation plan should be there, and evacuation exercise should be maintained and done every now and then in order to remind the people of how evacuation can happen in case if disaster happens. Emergency plan for hospital in the tense situation that the hospital are exposed to while the occurrence of disaster, spreading of pandemics, they should be ready through the following well-prepared emergency plan that contain a full preparation to transfer some ordinary rooms to be ready for emergency matter. So all the hospital rooms might be used as emergency room, providing plenty enough blood and plasma in as needed medication in conjunction with the blood bank and medical store also. Coordinating with the health institution according to the emergency access, working under the pressure, in addition to coordinate with the of the humanity team to help in organization. So all this it will be in coordination with others, coordination with the team, coordination with the super team within the community in order to deal with those cases. National Committee for Civil Defense, as the Sultanate carries of series of management, it has formed the National Committee for Civil Defense to process the operation of strategic planning and as well as legislation, the relevant laws and regulation. It seeks beside the training and well-rounded care to handle the emergency. Through its website, the committee furthermore offer electronic services as the follow: monitoring, early warning, medical and public awareness, search and resources, relief and shelter, also medical responses to public health, basic services, response to material also if needed, after the victim also of following those missing people and taking care of. So the level of prevention in case of the disaster, there are 3 levels of prevention. The primary prevention, which is concentrating in the prevention before the hazard or the disaster coming, which is include the community awareness, include the health education, include the plans and preparing the plans for dealing with those conditions, the health protection, also community member know what to do in case of disaster and before disaster. This is also safety before the impact is happened. So this is the primary. The secondary prevention, which is early diagnosis and in your position of safety until community or clear warning signal sound or those levels. So in this case, it is during the happening of the when the disaster happened, what to do, rescuing individual, and also dealing with them at the site, doing first aid for them, then preventing further injury, then the tertiary prevention, which is the third stage, rehabilitation of the people, rehabilitation of the site, rebuilding, reconstruction. So this is the tertiary prevention. Consequence of disaster on the health, we discussed this slide before. So physical, it is in taking element and injuries and disability, coma and death, psychological, cognitive and behavioral and social, structural damage to variable extent, ecological changes and change in the ecosystem due to the disaster, economical and financial losses, which is happened to the people and to teams. So this is the triaging and for the cases and how to deal with them. And thank you.